I think growing up as a child of Indian immigrants and living in so many different countries, I saw how important community is to have a, sort of happy and grounded life in a new country. And my parents always worked really hard wherever we lived to create that sense of community with other people, whether they were Indian or not Indian, and make sure that they were contributing within the town that we were living in and took the time to get to know people, our neighbors, and things like that. In addition, I think my background and upbringing really taught me the importance of giving back to our community and trying to ensure that people had the same opportunities that we did when they immigrated to the United States, which is why I became really interested in understanding the health of immigrants and how it might change when they move to a new country. And then finally, when I was growing up, we would go back and forth to India, and I could see how there were differences in the lifestyle, in the healthcare that people were getting back home in India and then in the United States. And I was also just really interested in making sure that everybody, no matter where they are, had access to information that would empower them to stay healthy. I mean, I think it made me think that, our health is not just about what we do as individuals. Our community, our family also affects our health, whether it be through support and, when things are difficult, or if you need help with your kids or someone to pick them up after school, those are the types of things that community is there for. We used to also have like a Bala Vihar group where we would meet in the basement of someone within our community to learn about Indian culture and Hinduism. And so, it was really a way to connect with the culture from back home. The other thing, though, is sometimes community and family can be challenging and make it harder to take care of our health. One thing that I've learned through my research and some of my observations is that there can be pressure to eat certain types of foods, or there might be pressure because of family or community obligations that make you feel like you don't have time to exercise or even visit the doctor. So I think in our community there's a lot of emphasis on education and making sure that you're taking care of other people and that you have a good job. And sometimes in that whole endeavor, the purpose of like health and taking care of our health can get lost a little bit. So I think there's positives and negatives. Think that I've been really lucky that I've had very good mentors throughout my career. People, whether it was in my undergraduate studies or even going back into high school, primary school, college, medical school, who were looking out for me and always encouraging me to pursue my passion for service in the community, my interest in research. And so I had a lot of support from good mentors. I think that they, really they saw that I was very curious from a young age. And so that's why they thought that like a scientific career, research career would be a good one. Also, my name Namrata, the meaning of it is like someone who's very gentle and sweet. And so in that way, also, I have a natural tendency to want to be a caregiver. And so as a physician, taking care of other people was important. So I really feel like the people who were in my educational and career journey did support me. That being said, when it was clear that I wanted to study immigrant health, the health of South Asians and other Asians, there was also some concern from my mentors and from the people who were supervising me, because they were concerned I wouldn't be able to actually make a research career out of this. I would never get funding. And, one of the studies that I'm a part of, the Masala research study, it took several attempts at getting NIH funding before that study was actually funded. And that's thanks to my collaborator, Dr. Alka Kanea, who tried 3 or 4 times to get funded and then finally got the funding to start the Masala study that's focused on South Asian health. So that's definitely one of the challenges that we faced, is there was not a lot of focus or interest on the health of South Asians in the United States. The other thing, as a woman, I'm also a mother, and I definitely think those life changes impact your career at different stages. And there wasn't always a lot of recognition of that when I first started my career. And I think that's changing. And there's more support for researchers who do have to take time off for parental leave, and things like that now, which is good. So I really want to learn from my own experiences and pave the way for junior researchers who are now trying to get their careers off the ground. What I would say is it is so rewarding to be able to think of a question that you're interested in and that's important, for the world if we can solve that question or that problem, and to have the resources and to have the knowledge and the collaborations to be able to pursue those types of questions, is really a privilege. And so I would encourage them, if you think there's something important, a problem that needs to be solved, I can't think of anyone better than many of these young women to actually solve these problems. So I have a lot of optimism for them. At the same time, medicine and science and funding are changing really rapidly. And so to be aware of that NIH funding has undergone a lot of changes this year, has become much more difficult. The system has slowed down, and their priorities are changing. So it's been a difficult year, but I am persevering because I really care about the work that I do, and I want to be able to improve the health of my community, and that's why I do it. And it's also changing, with the way we take care of patients. There's so much information now. It's very complex. And then also with some of these large language models or artificial intelligence, we just have access. Patients have access to so much information. We have access to so much more information. And it's kind of thinking about, how do we still make sure that the patient comes first and that we have enough time to give them, to take good care of them. The reason we undertook this study actually is because we've always heard that South Asians develop heart disease 10 years younger. They have heart attacks in their early 50s, even sometimes in their 40s. And that is on average 10 to 15 years before most other groups, where heart disease and heart attacks manifest in the late 50s or 60s. And so we were, interested in understanding, why might that pattern be happening? And do we have the data to be able to look at this question? And the nice thing is, with the Masala research study, we've been following people over time. And so the other thing is, we have used the same protocol as another study called MESA, which is a big study in the United States. So we're able to compare South Asians to people who are African American, Chinese, Hispanic, and white, and look at them over time. And what we were really interested in saying is, when do heart disease risk factors start to appear in these different groups? And do we see different trends? And I think, even doing all the work I've done, hearing these statistics, seeing people have heart attacks at young ages, I was really surprised to see that people who were South Asian in the Masala study had much more prediabetes, diabetes, and even hypertension than Chinese, Hispanic, and white individuals. They also had much more diabetes than African Americans, and about the same prevalence of hypertension. And this is really surprising, because the South Asians in our study actually had better diet quality and were doing just as much exercise. Because often people are like, oh, it's because of the South Asian diet. Oh, it's because they're not exercising. But here you have data showing, no, they actually have healthy behaviors. They're not using much alcohol. They don't use a lot of tobacco. But despite that, by the age of 45, South Asians have a higher prevalence of cardiovascular risk factors than other major US groups. And this, to me, is a very strong sign that we need to ensure that South Asians have access to early screening and prevention. So, in our studies, we enrolled people who were 40 and older who did not already have a heart attack or stroke. So we actually don't have information about people in their 20s or 30s. And so I would argue that, maybe the actual critical window is even earlier in life,
Okay.
but we still don't have that information. But what is important to know is in our studies, right, we enrolled people who already have not had a heart attack or stroke. So this is a critical window because even if you have a risk factor like high blood pressure or prediabetes or diabetes, these people have not yet developed heart disease that's, we've seen. And so it's a critical window for prevention. So this is the time to make sure you know what your risk factors are. And if you have any of these health conditions, to get them under control with medication and lifestyle modification. I mean, again, I think going back to the start of our conversation, we like to think everything is, on an individual level, but, we are all part of families and communities and a larger sort of ecosystem in the world. And so we may not actually have control over
Mhm.
everything, but the things we do have control over, which are making sure that you are eating lots of fresh fruits and vegetables,
Mhm.
whole grains, that you're getting regular exercise every day, and that you're getting enough sleep and you don't start using tobacco. These are the fundamental foundational things that we would like every family to be role modeling for their children and to encourage within their own families. But, again, just recognizing that people are under a lot of stress. Sometimes
Mhm.
people don't have control over what they eat. So we need to also be working at the same time with policymakers who can influence the environments that we are living in so that people are under less stress, they have good working conditions, they have access to nutritious food, and that the cities we live in are not polluted, that we can walk on the sidewalk. So I think this needs to be at the level of the individual, the family, the community, and even the whole socio-political structure. Yeah, so I think that the very first message is not falling for the model minority myth. The model minority myth is the idea that South Asians are successful, highly educated, and they don't have typical health problems that everybody else, does because they're not fitting that sort of stereotype. But actually recognizing that South Asians are a high risk group
Mhm.
and talking with your patients about, checking their risk factors, even if they're at a normal body weight, and also asking them about their family history. And then if they do have elevated risk factors, helping them get those under control with medication or lifestyle modification and providing culturally relevant lifestyle modification. So South Asians, the majority of them are immigrants. So their
Mhm.
diets are going to be different. And so recognizing how do you counsel someone if they're eating a South Asian diet versus a Western diet? How do you counsel people about exercise if maybe they didn't grow up in the United States and they have a different way of thinking about what is physical activity? So those are some things that are really important. And that whole idea of don't look for weight as an indicator of health, because what we have learned from the Masala study is that even at a normal weight, even at a low weight, South Asians still develop these risk factors. And we know that's because they have internal fat around the organs. Cholesterol is both genetic, because
Mhm.
our liver makes cholesterol, and some of that is determined by our genes, our family history. And then it's also based on what we eat.
Mhm.
And yeah, things like ghee, which is an animal product. So cholesterol is found in animal products. So anything that comes, from an animal, so butter, yogurt, milk, meat, those things all have cholesterol in them. So it's both how much cholesterol your body is making because of your genetics, but also how much you're eating. And, I don't know if it's true that South Asians in the United States are eating a lot of ghee.
Mhm.
Maybe, and a small amount of ghee is probably not harmful. It's just like with everything, you can't overdo it. And the majority of your diet should be fresh fruits and vegetables, protein, that's either legumes, lentils, fish, or lean meat. That's a really good question. And it's like, I don't know if there's one thing, of course, but I think one thing is definitely we need to have educational campaign within our community that really helps them, whether no matter what language they speak, no matter how many years they are living in the United States, no matter what your job, that people are aware of this risk and what they can do for themselves and their families to reduce their risk. So I think that's a very important thing, in addition to making sure that people have access to opportunities to be physically active, to eat nutritious food, and healthcare.